Before starting your refraction, always check your patient's previous glasses. The old prescription tells you the starting point, and the lens condition tells you if they are wearing them or not, and the frame fit tells you if the prescription is even reaching their eyes correctly. Old glasses gives you 80% of the story before the patient says a word. One mistake can cost you the patient's most important baseline. Never instill any eye drop before checking visual acuity. Before dilation, before any procedure, record the visual acuity first. Once the eye is dilated, that original measurement is lost forever. Visual acuity first, everything else comes after. If a child is becoming myopic, the single most evidence-based advice you can give is to increase outdoor time. At least 90 minutes outdoors per day has been shown to slow myopia progression in children. It is free, has no side effects, and works better than most parents expect. Everyone who uses screen and you who is scrolling now should know this. The 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. This relaxes the focusing muscles of the eye and reduces digital eye strain significantly. Simple to remember, powerful in practice. Normal blink rate is 15 to 20 times per minute. When looking at a screen, blink rate drops as low as 5 times per minute. This is why screen users easily get dry eye symptoms. Their tear film never gets a chance to refresh. So always remind your patients to blink consciously during screen use. Do you think cloudy days protect your eyes from UV? Think again, UV damage build up over time even during cloudy days. UV rays pass through clouds and reflect off water, sand and snow. That's why sunglasses with 100% UV protection are not just for a style, they are essential for your eye protection. Red eye is not always just conjunctivitis. Before anything else, rule out the sight-threatening causes: acute angle closure glaucoma, corneal ulcer, and anterior uveitis. These conditions require urgent attention. Always check the intraocular pressure, examine the cornea, and always check the visual acuity. Remember, a painful red eye with reduced vision should be treated as an ocular emergency until proven otherwise. Simple cover test takes less than 30 seconds and it tells you more about binocular vision. Never skip this cover test, especially in children. A small amount of squint missed in children can cause irreversible amblyopia. So do cover test for every patient every time. Glaucoma is the silent thief of sight because it causes no pain and no symptoms until significant vision loss occurs. By the time a patient notices a vision loss, permanent optic nerve damage may have already occurred. This is why regular eye exams are crucial. Tell every patient at every visit. Always check pupils as a part of every eye examination. An RAPD, relative apparent pupillary defect, can be the first sign of optic nerve disease or a serious neurological condition. It takes 30 seconds, costs nothing, and could be the most important finding of that entire appointment. Every diabetic patient needs a dilated fundus examination at least once a year. Diabetic retinopathy causes no symptoms in its early stages, but it is the leading cause of preventable blindness in adults. If your patient is diabetic, don't miss any early signs in the retina. The number one risk factor for contact lens related eye infection is poor hygiene. Never sleep with lenses not designed for overnight wear. Never top up solution, always replace it fully. Never wear lenses beyond their replacement schedule. These three habits prevent more serious contact lens complications. The ideal reading distance is approximately 40 cm. Too close increases accommodative demand and causes eye strain faster. Too far reduces print size and also strains. Especially for presbyopic patients, the reading distance directly affects how well their reading addition works. Always check reading distance clinically. Intraocular pressure fluctuates throughout the day. It is typically highest in the morning and lower in the afternoon and evenings. If you are monitoring a glaucoma patient, try to measure IOP at the same time of the day at each visit. This gives you a more accurate picture of whether their pressure is controlled. A child's first eye examination should happen before they start school, ideally around age 3 to 4 years. Children rarely complain about vision problems because they assume everyone sees the same way they do. Early detection of amblyopia, squint, or refractive error is critical because the visual system is still developing. Early treatment gives the best outcomes.
Click, clack, bullet. Click, click, bullet.